Okay, good morning everybody and welcome to the how-to session, Alcohol Action Planning for Local Government. My name's Michelle Lambert and I'd like to welcome you all here today. And I'd like to welcome you from the lovely Whadjuk Noongar country from which we're presenting on this morning. I'd like to pay my respects to the elders past, present and emerging. Today, we'll be facilitating this webinar to you from Whadjuk Noongar land, but people will be joining from all over, so you are welcome, but we would like to acknowledge the traditional custodians on the land on which we meet. Just a couple of housekeeping things before we get started. If you could please make sure that you add any questions into the chat function on the webinar. We've got somebody monitoring that chat and all of those questions will be answered at the end of our presentation. So please feel free. We'd love you to participate by putting questions in the question box. Also, if you have more than one person joining in your room with you, if you could just type the names of the people who are joining into the chat function so we can keep a record of how many people attended our session today. Also, if you have any technical issues during the presentation, if you could pop those issues into the chat function, we'll do our best to try and support you. And just so that everybody is aware, we are recording this webinar. Okay, so a little bit about Injury Matters to start off with. Injury Matters is for safer people and places. And we aim to do this by preventing and reducing the impact of injury on West Australians and the whole community of Western Australia. We do this through advocating and providing education for injury prevention, as well as providing support for people who've been impacted by injury. Today, the webinar that we're delivering is via our No Injury program with the support of the WA Department of Health. The No Injury program is a statewide program which aims to enhance the capacity of injury prevention and safety promotion practitioners to deliver quality injury prevention activities. The focus of this session is on alcohol. So today I'd just like to provide you with a little bit of information about alcohol. In 2019, at least once a month, one in 4 West Australians drank alcohol at quantities that placed them at greater risk. So that's one interesting stat, but some more recent stats which are quite disturbing are that each week in WA there are 8 deaths, 402 hospitalisations and 180 family violence assaults that are related to alcohol use. One West Australian is hospitalised every 25 minutes for alcohol-related harm. So that's equivalent to 57 people each day. This is one of the highest rates of emergency presentations due to alcohol in the country. In 2021, over 5,900 ambulances were called out due to alcohol intoxication. And sadly, 340 of those ambulance calls were to attend people who were 18 years or younger. But it's not only people who drink alcohol that are impacted by alcohol harms. While alcohol may not often be in our news headlines, it does impact almost every part of our lives, including our ability to access urgent medical treatment. It impacts safety on our roads and also violence within families and within the wider community. So alcohol-related injuries and other harms are preventable if we all work together. And local governments play a key role in community safety and injury prevention. And one way we can do this is through developing a local alcohol action plan, which is what we want to talk to you about today. So to take us through the process of how they went about developing a youth alcohol action plan, we have with us this morning Linda Parsons and Colby McGuire from the East Metro Health Service, and they're going to share with us a little bit of their learnings. So I'm going to stop sharing my screen so that they can share their screen, and I'll hand over.
Thanks, Michelle. We'll just get the screen set up and hopefully whereas the debtors approved.
It's not.
Yep, that should be fine. If you want to see your notes, you can do.
Okay. Thanks, everyone. Thank you, Michelle and Injury Matters, for having us here today. We'd like to acknowledge the traditional custodians of the land we're meeting on, the Whadjuk people, and pay our respects to their continuing culture and contribution they make to the city and region, particularly elders past, present and emerging.
Sorry. 2 secs. Stop sharing and then just try again. Is that working?
No.
No. That's odd.
Do you want me to share my screen?
Yeah, if you could, yeah. It's not working.
Okay, sorry folks for the interruption. I'm just going to share my screen and that way we can go through the presentation, but I will be operating the slides. So just bear with us for a second. This one? No, well, this is the one I was using before. No? Okay. Okay. All right, so we're acknowledgement to country.
Thanks, Michelle. We'd like to acknowledge the traditional custodians of the land we're meeting on today, the Whadjuk people, and we wish to acknowledge their culture and the contribution they make to the life around us, particularly of elders past, present and emerging. We'd like to say a big thank you to Michelle and Injury Matters for having us here today. And throughout this session, we're going to be jumping between us. I've got my amazing colleagues, Linda and Polash here, who have worked on alcohol action plans, Magdalene from City of Gosnells as well, and Ellie from City Cannings online. And we've also got colleagues who will be sharing a little bit later about how they can support alcohol action plans, with Hayley from LDAG, Robert from ADF, Michelle from Mental Health Commission and Denitza from Cancer Council. We'd like to, for today, kind of give a little bit of a highlight around the processes we've used. This is just what we've done. It can be done in many different ways, and we'll share some of the learnings and challenges along the way as well. So we are a local drug action group, so supported by LDAG Inc. and the amazing team there, and we're also a LDAT, so a local drug action team, which is supported through the Australian Drug Foundation. And what that does is provides governance and opportunities for funding, which we'll talk about a bit later on as well. With Magdalene and Ellie talking as well, we just wanted to acknowledge that in terms of the Alcohol Action Plan, while East Metro has taken on the role of coordination, it's really local government plans, and we couldn't do it without the great partnership of local governments and the other partners that we engage with as well. So I'm going to pass over to Linda next to me now, just to give a bit of a brief intro about the Alcohol Action Plans.
Very brief. Hi, everybody. Okay, for this presentation, as Colby alluded to, we'll be talking about 2 local drug action groups' collaborative efforts to develop the alcohol action plans. So the first one would be Armadale, Canning and Gosnells Alcohol Action Plan, which was developed in 2019 to 2022. This plan is now under review, and Polash will talk more about that later on. And we'll also be talking about the process that we used to develop the Youth Alcohol Action Plan 2019 and 2022, and that was launched in June on the 6th of the 6th. Firstly, just a little bit about East Metropolitan Health Service. We provide the backbone support for both local drug action groups, and we'll talk more about in detail about how we do that. But East Metro Health Service covers 13 local government areas from Serpentine, Jarradale to City of Swan, and the region is populated by approximately 740,000 people, which is 3 times the population of the Northern Territory. The region has the highest population of Aboriginal communities in WA as well. So the East Metropolitan Health Service team, health promotion team, it's a mouthful, works in partnership to create healthy environments and build collaborative collective capability for successful cross-agency collaborations. And the 4 key focus areas of East Metropolitan Health Service that we work within, chronic diseases are related to alcohol, nutrition, physical activity, and tobacco.
So we're going to talk a little bit about our approach today. You might have heard when we're talking about health promotion and prevention systems thinking approach. So what we recognise with systems thinking is, particularly with areas like alcohol, it's very, very complex. So you need to look at a systems approach rather than just targeting one area. And the way we implement the systems approach is for a collective impact system. And basically that's bringing everyone together. So there's lots of different agencies looking at alcohol harm prevention, and we're looking at a common agenda. We look at a shared measurement system, so how we can track data and use that in the same way to enable continuous improvement. And one of the main things is mutually reinforcing activities. So what we know is resources are often very scarce. So if we can bring our resources together and work together, then we get mutual benefits for that as well. When we're talking about collective impact, a really important part is having a backbone organisation. So an organisation that can have the role of bringing everyone together, have that coordination role. And within these projects, East Metro Health Service in the health promotion team has taken on that role. And really important part of that is that continuous communication. So it's about building relationships, building trust, maintaining regular dialogue and communication so that we're abreast of what's happening, current information, current community thoughts and what's happening as well. And what that does is bring together everyone as a common partnership, working together for that common goal. So within that approach, we've built on an approach with the Mental Health Commission as part of the alcohol management plans, where we've worked to build and maintain relationships, and we've formed a steering group, which for us is the local drug action group, but that could be any steering group with a number of different partners. In terms of the process, the really important first part is to gather the evidence. So you need to see where the harms are, what's needed, and this can be through data, hospital statistics, local government data that's available, but also anecdotal and what might come in for community surveys as well. Part of that data gathering is also consulting stakeholders and communities. So it's really important to see what else is out there so that we're not duplicating anything that's already happening. See what's happening from the community point of view as well, and from there prioritise the actions. Once that's all done, this was the really, really long process, which Linda and I greatly underestimated, was developing the plan. So that's really pulling everything together, And then having a really strong plan sets a really good basis to implement, evaluate and review. So basically today we'll be walking through a little bit more detail for each of these processes to develop the plan.
Our steps of developing alcohol action plan, how it started. So it's building relationships. The key
driver for us is to build relationship with our partner, having a common goal and a shared goal. What we have done in alcohol canning, in Armadale Canning and Gosnells partnership is that in 2017, I think it was April, where we brought back all the key stakeholders together and we had a meeting. We looked at data, we looked at issues. Why? To find out, is alcohol an issue within these local government areas? And what are the strategies are there? Do we need something to take action in that area? And yeah, all agreed that we need to take action. But it is not simple, it's complex. One organization cannot do it. It requires collaborative approach and some outcomes, which is in a long term, which is beneficial to all. So we looked into it and we gathered all the partners together and we decided we need an alcohol action plan. And we have 30 more alcohol action plans in WA, but this is a bit different than others because we have 3 local governments. We have Armadale, we have Canning, and we have Gosnells, and we have East Metro Health Service. We provided the backbone support. We coordinated the process. And for the local government and for the plan, we developed the focus areas. And each focus area will have its own strategies, own goals, own strategies, and own objectives. What it does is that we have plans, we have projects, and at the end, we brought everything together to have a collective impact, to look at a change. Are we making any change in alcohol harmonization in the community? I think the Belmont, Vic Park, and South Part also follow the same process, and I'll ask Linda to give us an update of what they have followed in terms of building partnership.
Yeah, we were very privileged to have Armadale Canning Gosnells as the first of the three local governments collaborating to develop an alcohol action plan. So we modelled ours on that plan. We have a slightly different focus, which is young people, underage drinking. But whereby the Armadale Canning Gosnells Local Drug Action Group was established after the implementation of the Alcohol Action Plan was created. There was an established Victoria Park South Perth Local Drug Action Group, which was chaired by PCYC Kensington. They had a few staffing circumstances and just a little bit of background, and it relates to building the partnerships and how important they are. East Metro Health Service saw an opportunity to move the LDAG towards a more collaborative and strategic approach and engage more stakeholders. So we were lucky that we did have ACG to model, and we'll call it ACG, that's Armadale Canning Gosnells, Belmont, Vic Park, South Perth, we'll just call that the BVPSP. And I might actually just go Belmont. But we were lucky enough to have the Armadale Canning Gosnells plan to model on, and approach to model on. But what we did to re-engage the PCYC LDAG was we collected the evidence, as Polash did mention earlier, and we highlighted the extent of the problem within the area. So it was really important to help the stakeholders understand that there is a big issue, and that was collecting all the evidence, anecdotal, what we knew from local government plans and conversations with local government to go forward. And Colby will talk more about that in detail later on in the presentation. We began the process of rebuilding new partnerships, and this included the City of Belmont. So then in 2020, the LDAG, which was chaired by the PCYC Kensington and now chaired by East Metro Health Service, was rebranded to become the Belmont, Victoria Park and South Perth Local Drug Action Group. From there, we ensured that we were very well prepared with the information to demonstrate the value add for each of the organisations sitting around the table, where it complemented their work, not adding any more work, but actually providing a supportive and systems approach to helping them achieve their goals and their common goals. We created a structure that meant establishing terms of reference. We also applied for funding on local government's behalf to implement some alcohol-free community events, which are little quick wins along the way. Very complex, as Polesh mentioned earlier, and this is a really simplified demonstration of it, or conversation about an approach that was taken to build the relationships and maintain those relationships. It requires a lot of communication, a lot of negotiation, a lot of shifting because things happen, and also it allows for responsiveness to requests. We really needed to demonstrate that we could be the supportive organisation that we were saying that we would be. But the greatest reward in doing all of that, and as Colby mentioned, it took a lot of effort, and we grossly underestimated the time that it took to develop the Youth Alcohol Action Plan. But the greatest reward is that the local governments and service providers and communities are working together and supporting each other to achieve their business goals and the positive health outcomes for the people that they serve. So the next slide here is just a snapshot view of the partnerships that we have, members on our local drug action group. I'll let you have a read of those. But there are many more, and you can see Injury Matters is one of our close partnerships that we work with as well.
Thanks, Linda. And I know at our recent launch, there's a really good key sentence from Des from Education Department that said, it's about working smarter, not harder. So in terms of the collaborative approach, he goes to a meeting and it's like having 12 meetings in one for him. So it's a really great network to have, bringing all the service providers together. So we did a brief snapshot of the process earlier. So we'll delve into a little bit more detail about gathering evidence. So for us at East Metro, we were able to access some stats around hospital data. So that was ED attendances for our local governments, some data around trauma as well, and also ambulance call-outs for from St John's. And for us, because our LDAG is youth focused, particularly working with PCYC and other youth services in the area, we focused a lot on the under 18s as well. For lots of this evidence, some of it is readily available through health profiles, and some of it might be a request to the health service providers, so that might depend on their capacity at the time as well. It's really good to talk to your partners about what is available and what's useful, and that can help narrow down the scope, as there's so much data out there that if you've got it all, it'll be just like a big jigsaw puzzle. So it's really useful to actually work out what area you might want to focus on first before gathering all that data, as it's, you know, using resources of all the organisations as well. We know particularly with our health data that sometimes the sample size is very small for some local government areas. So while it provides a really nice indication of what's happening, we know it can't be used for trends down the track, as you know, the sample size might change between one survey and the next. The qualitative data is really useful as well. So you know, talking to community service providers that are on the ground, looking at what data might be available internally at local government from community surveys, from the crime and safety team as well, and sometimes thinking outside the box in terms of data, as there might be other areas that you can link into as well with your partners.
Our next step was we engaged, we built partnerships with key stakeholders.
How to take it forward? So how to develop an alcohol action plan? How should we proceed? Put all our discussion in action and implementing it. How do you do it? So we thought of, let us do some workshops, and we organized 3 workshops. Both the plans have similar, but how they are facilitated a bit different. because Armadale, Canning, Gosnells was facilitated by Mental Health Commission, and Michelle will talk about it. And Belmont was facilitated by the Behavioral Change Collaborative. But the process, more or less, the context, how we proceeded, more or less the same. We looked at local issues. We looked at local needs. And it is all about local issue, local need, solution at local level. So we looked at the community safety plan that local government have, the public health plans, our state government plans. At the same time, there's a lot of consultation that happened. Though I said we started AAP writing in 2017, but the process started much more earlier, 2013. The consultation was going in the workshop, over the phone, face to face. So there are a lot of information gathering. So what we did with the data and everything and all the evidence, we set the scene to do something. We looked at best strategies, best practice strategies, which worked, which didn't work, which setting it should work, because we're talking about a local level. And we looked at local issues and what is already happening. What's the good work that local government, non-government organizations, and we are doing. Let's combine and put it together. We looked at expert opinion. So Mental Health Commission, Michelle, and she will talk about it a little bit more, from Cancer Council. So we took guidance from other stakeholders, stakeholders too. So that was our workshop 1. With Belmont, Vic Park and South Park, because it is mainly youth, they have done 2 more workshops, and that was actually excellent. They exchanged views with the youth, young people, and 45 did participate, and the information they provided was really great. And that reflects in the plan they have launched about 2 weeks back, and that was fantastic. So the next slide, please. Yeah. Then we went on a workshop 2. What we did in workshop 2 is we unpacked a lot of things in workshop 1. We brought everything in the workshop 2. So let's look at the issues. Look when, where, and what happened. So what is our priority? So let's pick 3 topmost priorities. Is it priorities within scope? Priorities which is achievable? Priorities which is actually connected with the stakeholders, which make sense to the having an LDAC and shared views, shared responsibilities, and shared wins. So based on the priorities, we looked at objectives, and certainly it has to be smart, so we have to measure it. And the objective went to strategies, and it was these were all local strategies and must be evidence-based. And we involved everybody to have their input, not only in the workshop, also outside after the workshop, getting their feedback and getting everything ready. So the document was, all the information was ready, and now we went for the workshop 3. Workshop 3 was pulling everything, all the information together in one plan and looking at commitments, because we'll have a plan, and we need to have an LDAC which is committed to implement and work as collaboratively and work in partnership to achieve those goals. I think we'll go to the next slide, and the next slide also talks about putting the plan together, which I and Linda can share. So Linda, will you start?
Yeah, sure. Thanks, Polash. Polash mentioned the process of 3 workshops to collect information from a range of stakeholders that informed the action plan. And similar to the Armadale, Canning, Gosnells, Belmont, Vic Park, South Perth, held 3 workshops as well. And in addition, as Polash mentioned, the 2 workshops for 45 young people to get their perspectives and insights and ideas that were fed into our action plan in the end. So there was a mountain of information that was collected from stakeholders, and all of this needed to be synthesized and assembled into some form of a draft plan. Again, I want to stress that you need to allow yourself time to do all of this, because the mountains of information that was collected, and really excellent information, was quite tricky to distill down into some key focus areas. And in the Youth Alcohol Action Plan, we have 5. We could have had a dozen, but we've distilled it down to 5. And these were related to what was most important for local government and stakeholders alike. So again, a very collaborative, collective impact type of approach we used. But for the backbone agency, and that's and that's us. We needed to establish, as Colby mentioned, the why by gathering all of the data, the evidence, the anecdotal evidence, having the conversations with all of our colleagues and partners to really sort of talk about the problem and the issue, to highlight that this is a real issue in your community. And that was national, state and local data. Then coordinating stakeholders to determine the vision. So what did they want, and the goals, you know, and the aim of the plan. What do they want to achieve? What will tick their boxes? How will this create a healthier community for them? And once that was all synthesised, the plan was distributed to all of the stakeholders for their feedback, and we were able to frame the content into a plan. Won't go into too much detail about it. As Polash alluded to, it's very complex, the process, but bottom line is, and we're going to keep saying this, it's communication, communication, communication. Up front, there needs to be clarity about how the plan will be developed, and it's important to keep people informed throughout the whole process of the development. Otherwise, you're losing people. So there were periods of time where we needed to take a step back and, for example, synthesise the information, which took quite a bit of time. In the meantime, we needed to communicate where to our stakeholders that had provided all of that information, where we were at, what we were doing next, and how and some of the things that we've already achieved along the way. That kept people engaged. Then it was review, review, review. So we really needed to make sure that our plan was salient to all of our stakeholders. They aligned with all of the focus areas. They were happy with some of the actions that we were looking at. Then it was the endorsement phase. So once the local drug action groups for both Armadale, Canning, Gosnells, Belmont, Vic Park and South Perth had agreed to the content of the draft plan, then it was putting it into the final plan, and that was design and artwork. And then the process was that the local, that the LGAs then needed to get endorsement from their, what do we call, high management, And this shouldn't be, this wasn't a last minute thought. So along the way, the local governments were communicating with their colleagues about the plan and what they were doing, and so it wasn't a surprise when these people, I can't even remember, I don't know who we're talking about, like councillors, for example, and the mayors needed the endorsement, and we needed the endorsement from, and once that had been provided, ready to launch. Along the way, because it was such a long process, all up it took between 18 months for the Belmont, Vic Park, South Perth action plan to be developed, and then another 6 months to apply all of the artwork. We did some quick wins along the way. So we applied for some funding for local governments to implement, say, alcohol-free community events, for example.
So may I add?
So if I give an example of the Armadale, Canning, Gosnells LDAC, and what just Linda talked about, putting the plan together, commitment. So the group was committed to AAP from 2017 to 2018. So that's a tick for us. Communication, we had a very beautiful communication. We had an open channel. Magdalene is here, Ellie is here, and we have other stakeholders. We are always talking. And now we are reviewing it. So it is a success, and it is an example for all the local government, for state government, how a partnership can go along, what a partnership can achieve, and what does it have an impact on the community and the stakeholders too. And certainly we'll talk about some quick wins that we have in our SCG LDAC. Yep, thank you.
Thanks, Polash. You've heard us refer to using the evidence and the evidence space. The good news is most of it's already been done. So when we were synthesising the data, we were always referring to some of our state, national and international best practice plans. So that includes the mental health in mental health commissions, mental health promotion, mental illness, alcohol and other drug plan. We've got the WA Health Promotion Strategic Framework, the National Drug Strategy, which already have really, really good best practice interventions in there to draw from that we can look at localising as well. Importantly, looking at local government as well, we want to ensure that it's not adding on to what local government's already doing, that we're actually integrating with plans that already exist. So we had a really great document that DNITSA did for us with Belmont, Vic Park and South Perth, where DNITSA actually went through the different plans from our local governments, including public health plans, community safety, community strategic plans, and pulled out actions that related to alcohol so that we could show that we were aligning with what was already a key target in local governments to address alcohol. A couple of examples here is from City of South Perth, one of our very active partners that has a great public health plan. And in terms of reducing harm from alcohol, they had a few key areas, including partnering with the LDAG, increasing alcohol education, information, having alcohol-free events, encouraging groups to apply for health-free funding with Alcohol Think Again branding. So that's increasing the message in the community, looking at planning controls, alcohol management plans internally, and looking at the scope to restrict alcohol advertising on city assets, which we'll talk a little bit more about in some case studies to come a little bit later on in the session. So I'll pass the call Ash now to talk about Armadale.
As
Colby was saying that Alcohol Action Plan is not Alcohol Action Plan is nothing separate from any other plan. It's a part of existing plan, the state government plan, the local government plan, and all those plans. So when we did the Alcohol Action Plan, we looked into that. Does it relate or reflect to the local government public health plans or the community health and well-being plans? And one of the example was the City of Armadale Alcohol Action Plan and strategies. And if you look at that one, you will see there are strategies that is within the AAP2, such as advertisement. So in terms of local government, what they can do to restrict advertisement on alcohol, not only alcohol, tobacco and junk food too. So look at a better management of liquor outlets, or working very closely with the bottle shops. Look at the policy changes. What all this thing has done is to address the issues, address strategies, and promote safety within the community. And that is community safety is what and community engagement, that we all have a common goal, local government and state government and NGOs. All right.
And we have Ellie from City of Canning online. So hopefully, Ellie, we can pass over to you to talk a little bit about the City of Canning.
Are you there, Ellie?
Hi.
Hi, Ellie. We got you. Tell me when you want the next slide.
Okay, so I am talking a little bit about the linkage to our public health plan. Can everyone hear me?
Yes, we can hear you, Ellie, loud and clear.
Okay, great. Yeah, so our public health plan which aligns with the city's vision of creating a welcoming and thriving city, and that came from the community's aspirations in our strategic community plan. Our vision for our public health plan is for a healthy, livable and socially connected community for all residents. So the vision recognises the city's desire to continue to create supportive environments that make it easy for our community to participate in and choose healthy lifestyles. We want to enable health promoting environments that encourage healthier choices and behaviours. So that links in nicely with a lot of the strategies that came through our Alcohol Action Plan. Specific questions in our engagement processes for the public health plan around alcohol gave a overwhelmingly high yes result for the support of harm minimisation around alcohol and tobacco. So this sort of information has helped inform our commitment to the Alcohol Action Plan and completing and supporting the actions in the Alcohol Action Plan. So yeah, it links in nicely with our existing plans and what we're striving through to do at the city. So yeah, it's this also looking at, oh, next slide. Sorry, they're just a bit out of order. Oh. Hello?
Hello, is that your next slide? That's the next slide I have.
Yeah, sorry, I don't have the same.
Oh, sorry about that.
What would you like me to cover next? I've got a few items to discuss around the bus stop auditing we did, around our advertising on city-owned infrastructure, and
okay, Colby
also,
is just saying that we'd like to hear that a little bit later.
Okay.
So
okay.
we'll put you on mute now. Ellie, thank you for sharing that bit, and we'll come back to you.
Thanks.
So we're back to Linda and Colby. And is that the correct slide? Oh, keep going. Yeah.
Thanks, Ellie. It's really great to share about Canning's public health plan and how it links in. So we've talked about the journey of developing the plan, and now we're going to move on to the implementation and what we've done in terms of the plans. Alcohol Canning Gosnells, as you can see, that's been in action for 3 years. So there's a few more case studies from that. And Belmont South Perth one has just recently been launched. So as we talked about before, LDAGs are both a local drug action group supported by LDAG Inc. in WA here, and also a local drug action team, which is a federal program but supported locally by staff members at Alcohol and Drug Foundation. And we receive an enormous amount of support through these teams in terms of funding opportunities, resources, training, advice. So for us, it's been really beneficial to be part of those organisations. The LDAG for us provides that overall coordination and steering group, which we've been chairing for our Belmont, Vic Park, South Perth, and it just provides a structure for implementation of the plan. I must stress this isn't required in terms of an alcohol action plan. This is just the structure that we have used. So in terms of the actual plans, we have a few different target groups. Ours is focused on young people, and there's also strategies in ACG for young people as well. We look at parents and persons of influence, particularly around supply of alcohol to young people and the secondary supply legislation. Some settings we target are schools, outlets, sporting clubs, local government venues and service providers, and also the general community and those members requiring treatment relating to alcohol use, which has been part of the ACG's plan. So I'll do a pretty brief run through of the focus areas and actions. And for us, this was based on what came out of the evidence, the workshops with stakeholders. We had over 45 stakeholders at our workshops. We had the workshops with young people as well. So it's a result of pulling together all that information, and it might be slightly different for each area, but we found predominantly that these align with some of the state and national areas as well. So we have reducing availability and supply of alcohol to under 18s, and for us we've had leadership from Department of Education with the Road Safety and Drug Education branch, and also Cancer Council WA through Denitza and Stephanie. So in terms of this area, we've looked at parent communication plan, which ACG has implemented, extending the reach of the Alcohol Think Again Parents and Young People campaign. So this is a campaign developed by Mental Health Commission. It's a statewide evidence-based campaign. And what we recognise is that the work's already been done around that. It's a really well evaluated and tested campaign, so we don't need to do our own. And sometimes doing your own can actually filter out the impact of those campaigns as well. So we look at extending the reach of those already in practice. We looked at building capacity of service providers to implement interventions. So for our LDAG, we had support early on with Mental Health Commission completing training with our LDAG about alcohol management planning and upskilling as well around alcohol interventions. Particularly ACG has had some really good success with increasing the uptake of evidence-based programs such as Good Sports. Again, we're not looking to bring in any new programs, we're looking to increase the reach of those evidence-based ones already operating in the community. And also working with racing, gaming and liquor to increase compliance of licensed outlets with the existing Liquor Control Act. So that's about not supplying alcohol to under 18s and the ID checking. Another main area is reducing exposure to alcohol advertising. So this came about as there's a lot of research around if young people are exposed to alcohol advertising, it actually increases what they will drink and increases the likelihood that they will start drinking alcohol earlier. And it's also about that brand recognition, which there's a lot of research about as well. So again, supported by Cancer Council, we're focusing on providing some really good baseline data around what advertising is already happening on local government assets, and we'll talk about that more in the case studies, and then how we as a group can support local governments to restrict alcohol advertising on their assets, and also some community advocacy as well. For Belmont, Vic Park and South Perth, we know a key protective factor is young people being engaged in the community, having links, having really positive adult role models as well. So we have a focus area around young people connecting and leading in the community. And it's about connecting with each other, but also service providers. There's a lot of services out there and available, so it's trying to make them accessible and easy for young people to access. It's about linking service providers with each other. So we've got reduced duplication and increased resource sharing. And it's about increasing participation of young people in the community. As if we know there's things to do, there's less likely to be underage drinking as well. And also really looking at leadership opportunities for young people and involvement in planning, as we know it's really important that young people have an opportunity to have a say of what happens in their community, and it's likely to increase their participation as well. So we'll move on to the case studies. We'll share some of the case studies and actions taken to date, and I'll pass over to Magdalene to talk about some of the work in their area.
Thanks, Colby. Okay, so ready for the next slide. Thank you. So to reduce the availability and supply of alcohol to under 18s, the cities of Armadale, Canning and Gosnells worked to extend the reach of the Alcohol Think Again campaign. This included displaying advertising posters at our facilities and sharing social media posts that promoted the campaign. Each of the local governments were also successful in applying for $4,000 of Strive funding via LDAG Inc. And we used this funding to promote the ATA campaign in our areas. The City of Canning obtained first round funding and promoted the campaign on advertising screens located at Wellback Golf Course and the Cannington and Riverton Leisure Plexes. The City of Armadale and we at Gosnells then applied for funding in round 2. We coordinated our advertising to occur at the same time in the period before and during Leavers Week. We advertised on billboards along Albany Highway to saturate the corridor between Gosnells and Armadale, and used the remainder of our funding to display posters at both the Armadale and Maddington train stations. And again, this was a collaborative effort. We received support from East Metro Health to put together our applications, and the Mental Health Commission also helped put together our artwork. Next slide. And then at Gosnells last year, we ran a very small pilot program to visit some licensed venues and provide compliance signage. In the lead up to Leavers Week, we visited 6 drive-through liquor outlets and observed that only 2 out of the 6 were displaying any compliance signage. The 4 outlets that were not displaying signage appreciated the visit, and they were happy to accept the signage and display the signage in each of their premises. So we are interested in expanding on this when Leavers Week again approaches. We have in local government environmental health officers that are either directly visiting or attending premises that are in the vicinity of licensed venues in order to undertake their routine food business or public building inspections. So there is certainly potential to incorporate these visits into our routine work, which is great.
Thanks, Magdalene. We've talked a little bit about one of the areas reducing exposure to alcohol advertising. So as part of this, we've tried to provide a baseline information, which Canning has done as well, and Ellie will talk about shortly. For our Belmont, Vic Park, South Perth audit, we were fortunate to have the support from Curtin University with health promotion students doing their practicum placement with us. So we had 2 students that completed 6 audits in autumn winter, and then another 2 students that completed spring summer audits, and the audits were completed fortnightly. The reason is that the advertising is changed fortnightly, and for our 3 local government areas we had 89 bus stops, or 100 of total of 178 advertisements each fortnight. So you can see there's a lot of data in there, and we were just so grateful that we had amazing students that completed this work for us. What we did, because we had the 2 audits, we looked at some of the differences in terms of seasons and how we can use that going forward for sorry, wrong button. We've got a snapshot of some of our results, and some of it was as we expected. So in the autumn winter audit, we had roughly about probably 5% of ads were for alcohol. We came to spring summer, and that was around the AFL Grand Final that was held in Perth. We had the spring racing season, we had Christmas, New Year coming up. So it increased in some areas like Vic Park by 4 times, by 2 times in other areas. But we had around, particularly in South Perth, 15% were alcohol adverts. So about 1 in 6 that our children are seeing were alcohol advertisements. And we know outdoor advertising, you can't turn it off. It's always there. So it's a really important focus for us to try and create that healthy environment. And I'll pass over to Ellie to talk about the Canning project and where they're at, as they're a little bit further ahead in that process.
Thanks. Okay, so yes, we did our audits sort of as a result of the joint alcohol action plan, we did our audits end of 2018, early 2019. And this was as part of our, the identified strategy to help meet Objective 6 to reduce young people's exposure to alcohol advertising. So the audit was a little bit smaller in terms of we didn't do it across different seasons, but there was 23 bus shelters in the city of Canning. Auditors followed a pre-planned route within the city every 2 weeks from December 2018 through to February 2019. And the result showed that what product type was within each ad recorded with alcohol in it. So almost 1 in 10 bus shelters of the ads had alcohol products, including wine, beer, and spirits. This information was then used to, as part of our discussions when we started to look at contracts renewals for signage in Canning around city-owned infrastructure and how we go about deciding what goes on these spaces. So the initial discussions were started with various stakeholders across the city for all different types of input. Obviously, there is a negotiation process around other aspects for the city to consider, aside from just the content of the advertisement. So things such as looking to convert to digital screens, sustainable agreements that incorporated ongoing maintenance of the infrastructure as well. So we weren't the only consideration, but it was very useful to have this audit and a bit of background to come to the table with, and also the backing of our public health plan and the alcohol action plan that we had made commitment to and was embedded in our strategy. So it was suggested in the discussions that it would be a missed opportunity if we didn't seriously consider including restrictions around alcohol advertising on the locally owned assets as a local government, or at least having controls that are meaningful, given that these agreements are such long life, some of them up to 10, 15 years. So that was good timing in terms of that they actually came up for renewal. So the opportunity was there. So the discussions, we incorporated the audit results and linkages into our public health plan and commitment to the alcohol action plan, as well as some evidence that we had support from FAWA at the time that helped us look for other examples where, including state government, where the trend of removing alcohol ads from government infrastructure seemed to be on the rise. So that really helped in terms of the support from our LDAG group to get that background information and put our comments forward. So at the moment, we are currently, it was a little bit delayed in our tender process. There was a bit of a hold up, so we still haven't actually gone through to the final approval for the contract, but the controls or wording we came up with are around that advertising that promotes alcohol or the consumption of alcohol is prohibited. So that is including things like alcohol brands, alcohol retailers, and other forms of alcohol advertising. So the reason we included the wording of that nature was because it's not just about the product itself, it's about the depicting or promoting of the consumption or activities in an advertisement that sort of lead to promotion of alcohol as well. So it's currently with our legal advisory drawing up fresh agreements to go with the request for tender, but we hope to have a new contractor on board by the end of the year and to have these controls included.
Thanks, Ellie. And there are some good precedents set already for advertising. So we're hoping that it's a strategy that will be successful with our local governments as well. Moving on just to another quick case study, and this is probably one of the quick wins we were referring to as well. For Belmont, Vic Park, South Perth, LDAG, we received Strive funding through LDAG Inc. to have a youth-focused event. And this for us was a bit about, an activation event, getting people involved, getting stakeholders and young people. So it was held just a few months ago in April at the Manning Hub. And we had an amazing race style event. So students had a map with questions based on the Alcohol Think Again campaign, and they needed to visit each of our 11 service providers to receive an entry stamp. We had a Youth Choices performance by the Constable Care team, and we had some really great positive role models with the national hockey team, Kookaburra's co-captain Aaron Zawaski, coming and chatting to the kids about his experiences, what he does in his life, and really just providing that inspiration for the young people coming along as well. So we had 50 young people, around 30 parents, and all up about 14 service providers. And taking into account, like, this was our first big event, but we're also at peak COVID numbers as well. So all in all, we were quite happy with the events and the attendance. And South Perth, who co-hosted in terms of location, they were looking at having this as an annual event that we do as a collaboration with LDAG. It's potentially one we could expand to other areas as well. It was also during Youth Week, so it's a really great timing in terms of just having a fun, positive activity for the kids in the area to do.
With the SCG LDAC, from 2017 to started 2017, and our plan was from 19 to 22. So it's a review time for us. And certainly we have the momentum going, and we looked at taking it forward, taking it for another 3 years. And for this purpose, we have done 3 small workshops. And certainly Magdalene is here with us, Ellie is here with us, and Michelle is here with us. Please do feel free to add if I miss something, or if there is something that I have skipped. So this is a way to look at, it's a better way what we do, better way how we do it, and better way how we can take it forward. So as a part of the process, we looked at evidence. What we have done from 19 to 2022, what's the data says, what we have achieved, what sort of challenges, what sort of outcomes did we get. For this purpose, we did consultations, which is same as within the workshop, face-to-face, over the phone. And we looked at our priority areas. Is this the priority areas? We reviewed that one. So in our last one, we had underage drinking, antisocial behavior, and working with stakeholders. Is this the priority still? So we looked at those, reviewed those. We looked at the objectives. Do we need to collapse into one? Do we need another objective? Is it smart? What about the strategies? What strategies we have completed? What strategies we have a challenge with? And what we need to change and what we need to add? And what other evidence do we need to gather to take it forward? So we have just finished our last workshop last week, and we have all the information now. Like Linda was saying in the last slide, putting everything together is the same thing. We have the momentum going. We have the commitment going. It's communication, it's review, and it's taking it forward to 2025 and probably beyond. And at the same time, evaluate it as a collective impact. And that's what we have said, shared goal, shared views, local solution in local level. So now for the next slide, actually, I'll pass it. In the next slide, we look at some quick wins. I think some of them already been talked. Magdalene spoke about it, Ellie spoke about it. And this is a list of some quick wins we had. We had done a school audit. What we have achieved, we looked into the programs they have, the communication parents, teachers, and organizations having, what it resulted into. And if you look at the last one, parent communication plan, and Linda is here. She was the lead for that project. We engaged 2 schools, and we have school TV. Some of you may have already heard, and that is implemented in 2 schools. We looked at resources. We had funding, and we have actually disseminated all the resources through local governments, through non-government organizations, through our channels. And at the same time, we did a levers program. We know it happens in Bustleton, but some do happen in local area too. So we focused on that one. And one of the good thing that happened was good sports. Now, local government, through the support of local government, they coordinated. We had 18 new clubs in the last 3 years, and that is really good. And certainly Magdalene talked about the signage and the no alcohol, think again, all those campaigns. And these are quick wins, but it has a very good, big impact. Community sees it, and communities see as local government and the LDAC as a solution driven plan rather than just talking about it. All right, I'll hand over to Magdalene now for the next one.
Thanks, Polash. So the ACG plan is also award-winning. The cities of Armadale, Canning and Gosnells entered a nomination and were successful in the action on alcohol category of the 2019 FAWA. So that's the Public Health Advocacy Institute of WA's Local Government Policy Awards. The reward recognised that the plan was the first of its kind in the state to tackle alcohol-related harm across 3 metropolitan local government areas, and also the work of the key organisations involved to form a partnership approach to reduce alcohol-related harm in our communities. So now I'm just going to talk on some of the things that have worked well with the ACG plan. And so on to the next slide. Here is a list of what has emerged during the plan's review, and also from reflections by East Metro Health. Things that, you know, Polash has spoken on, such as having local solutions to local issues, and also that the plan acknowledges a lot of the work that already occurs in our respective organisations. Just speaking on a couple of things there that are most relevant to local government, I would say certainly, and it's been mentioned several times, the backbone agency support really is instrumental to the success of the plan. Getting so many stakeholders together and on the same page is a significant task, and having East Metro Health drive the project has been great. And also that they ensure that everything we're doing is evidence informed and best practice. Being involved in the project has also improved our connections with a number of other organisations, including the Cancer Council, Headspace Cannington, and Hope Community Services WA. The flexible approach in terms of our involvement has also worked really well for us in local government. From the very beginning, East Metro Health were open to our participation in individual actions being flexible according to our resources and our organisational priorities. So there have been times when we simply haven't been able to work on an action because we don't have the resources, or we haven't been able to get buy-in from another department in our organisation, and that has been fine. Colby has also touched on the benefits of pooling together our resources. And, you know, an example is we at Gosnells have derived a benefit from, you know, saying having Ellie at Canning spending time researching advertising contracts. And I really believe we can and should be doing a lot more of this in local government. The next. So they are some of the gains, but obviously there have been some challenges in coming together. It hasn't all been easy, and I guess COVID just goes without saying. It has been very challenging. It has affected our organisational capabilities, and for a period, our connections across the different organisations were affected and weakened for a period of time. In terms of rolling out the individual actions, we all have different budgets. resources and priorities. So again, Canning have achieved great things in the advertising space, whereas we were not able to achieve the same success for a variety of reasons. And I guess the evaluation space is another one that has been a little bit challenging. There have been aspects of the plan where I guess it's difficult to measure its impact or success. And I don't know, Polash, I think if you've got another couple of points on the challenges.
Yep, with the SEGL, like it's a good learning track for all of us that what a partnership can do and how to best manage a partnership. And because we are coming from a different areas and it's a mixture of different expertise, it's an exchange of knowledge, and it's proven that what we can do collectively as a team, we can only dream as an individual organization. So it's sharing their skills, sharing everybody's knowledge. And certainly there are challenges. I think these challenges are as a learning. We learn from the challenges and that will reflect in our review. And I am very grateful to have the support, the local government and the partners we have in LDAC. Probably without everybody's input and commitment, and getting them all together in one space is a challenge by itself. And we have actually done quite good at it. Yeah, thank you.
Thanks, Polash and Magdalene. We'll just touch quickly on some of the support available from East Metro Health Promotion Team. Just keeping in mind, we're obviously one health service provider. There's also North Metro, South Metro and WACS, and we all do have different capacities in this area. From East Metro, our capacities just change at different times as well. We've been fortunate that we have had the capacity to have that backbone agency role with Belmont, Vic Park, South Perth and also ACG. Some of the other support we can provide is where it's relevant and there's been some scoping done, we can assist in sourcing some data around Hospital of St John's. We can also provide advice and consultation on best practice strategies, what works, what doesn't work, and facilitating connections with partners and peak bodies. So that's been really important in terms of our projects of working with the experts in the area, such as Cancer Council, Mental Health Commission, LDAG, ADF, education. We have police on our LDAG as well. So providing some of those connections as well is something that our team can do for the East Metro local governments in our area. I'm just going to pass on to Linda, who's going to chat about some of the helpful tips which we've touched on during the session.
Thanks, Colby. Yes, we have talked about the value of the partnerships and working on a collective impact model. We've talked about that. That's really the critical element of developing up a plan, is establishing the networks that you'll be working with, seeking out the expertise from your networks, and also aligning with networks core business as well. So we're not creating any extra work, we're actually supporting local governments with implementing strategies and service providers as well to ensure work towards a healthy community. But I guess one of the biggest helpful tip that we can offer today, and haven't really talked much about this, but develop a high level plan. And by that we mean not to be too prescriptive, because evaluation, as we all know, is really quite tricky and quite difficult. Our communities and the landscapes change frequently because of things like Magdalene mentioning COVID and a number of other things. So resourcing is another issue. But if you develop a high level plan, so talk about what you want to do, what you want to achieve, your strategic focus area, and some of the activities that you'll undertake, allows for flexibility within what you do, what actions you might take, and also it allows for responsiveness in your community to meet their needs over time. So don't lock in strategies in the plan. That will come when you start looking at your focus areas and what you want to implement, and the working groups will then delve into the specific strategies that they will implement to meet that focus area. The other thing is establish who your leads will be for each focus area. For example, we have the Department of Education who will lead the underage drinking focus, and we've got Cancer Council WA who is going to be leading the accessibility and the marketing strategy in the Youth Alcohol Action Plan, for example. Establish the why. So this is really important. Ensure you have a good understanding of the problem in your local area. You have a really good head around national, state and your local data and perspectives of what's going on in your community and what your community are asking for. And local governments have got reams of information on that. And that's when we've drawn a lot from that to develop our plans. See where you might be able to add value to what you're already doing as well. So you're already working on several health promoting type issues, say nutrition, for example. This all applies to all of those areas that you're working on to create a healthier environment. So what else can you do in that area that would add value through your networks and groups to support you? Putting the greatest effort, we've emphasised this throughout, is into building your relationships and during this process, and that rewards you with ongoing commitment from your stakeholders and stakeholder organisations to support the implementation of the plan. And lastly, just, communicate. We've talked about that throughout the presentation, but take the time needed to develop a quality plan. And also through the implementation phase, so that you are really, you've got a current plan. And that means review as well throughout the process of developing a plan, but beyond and through to implementation. Give yourself the time, and really we grossly underestimated how long this whole process would work, but don't rush it, because you want to have a product that you're proud of and that is easily implemented at the end, and you're not trying to play catch up. Try and get it as correct or as done well as possible right up front, and just take the time. So don't bed yourself down to time frames that will always blow out. I don't know anybody who can do time management well, but you can manage your time well through this by giving yourself extra time. Coordinating lots of people creates lots of challenges, and there'll always be curveballs. So, and enjoy the process. I know I'm kind of maybe feeling that we're making it sound really difficult and really hard. It's not really. It's just intense, and it does require a lot of effort in constant communication. To develop and make sure that you're sort of keeping the momentum going, particularly as it does take a while to do, but the effort's worth it. And we have now, I'd say confidently, within Armadale, Canning and Gosnells, Belmont, Vic Park and South Perth, stakeholders who are super engaged and really now super connected. There's a lot more work that you can keep doing in that regard, but it's working together, and that is such a great reward, and that translates to a healthy community. So yeah, thank you.
Thanks very much to the East Metro team, to Colby, Linda and Polash, especially Polash for stepping in at the last minute, because Assunta was unwell this morning, so we really appreciate you coming in. And we'd like to say a special thank you to Magdalene from the City of Gosnells and Ellie from City of Canning for sharing. Our next speaker this morning is Michelle Gray. So Michelle, I'm going to stop sharing my screen. And Michelle Gray comes to us from the, from Mental Health Commission. Sorry, my computer's playing up. There we go. So I've stopped sharing. So Michelle, I'll hand over to you.
No worries. I'm just going to try and share my screen. Have a look. Okay, I'll just share screen. Can everybody see that?
Yes, we can. Thanks, Michelle.
Perfect, perfect. Well, thank you, Michelle. And I too would like to just acknowledge that I'm actually presenting on Whadjuk Noongar Boodja. And I'd like to acknowledge the Whadjuk people who are the traditional custodians of this land. I've been very fortunate in working in Community Support and Development Programs team, which was previously Community Programs, when we first looked at the Armadale Canning Gosnells plan back in 2013. And these sorts of plans have been around across the state for well over 10 years now, and I've been part of them all the way through. So hopefully I can just add to this a little bit and give you a bit more of perspective of how a mental health commission can actually work alongside local governments and health services and our community alcohol and drug services to develop these types of plans. So that's just a quick screenshot of what the commission looks like. We are a huge beast, but the area that we're interested in is around here, the alcohol and other drug and prevention services, and the mainstream around prevention services. So within that prevention directorate, we have the Safe and Healthy Settings team, the Community Support and Development Programs, which is where I work. We also have public education and health promotion programs. And again, the team have mentioned some of these smaller teams within the prevention branch supporting the local government alcohol and other alcohol management plans. We've also got Strong Spirit, Strong Mind Aboriginal programs team. So for areas where there is a high population of Aboriginal people, there's an ability there for some culturally secure resources to be used in some of the plans. And also workforce development and our alcohol and drug support services. But as a whole, the Prevention Directorate has had a long-standing relationship with local governments and with WALGA, working together on alcohol-related harm over many, many years. So I am going to talk about two main areas though, the Community Support and Development Programs team where I'm from, and also the Safe and Healthy Settings team, just to give you a bit more perspective. So in terms of the Community Support and Development team, our role is supporting our contracted services and services such as East Metro Health Service in developing these sorts of plans. And so we've had quite a bit of experience over the years developing up the process. And I did see Jen Payette just pop a little question up earlier around that. And the process that East Metro and the Belmont Vic Park have taken is very similar to our alcohol management plans, but there are some differences as well. So in terms of the Community Support and Development Programs team, we target capacity building and workforce development for community agencies. So in essence, what we're trying to do is help those services convert the evidence that we can see for strategies working into practice. And we've always been very mindful that services bringing a multitude of services together to work on common goals, and pooling of resources is really important and it's timely. And as Des from our education seat has mentioned, it is like having meetings with 13 other stakeholders at the one go. So it really does make good sense. We also support establishing and maintaining state and regional and local networks. We also influence funding for evidence-based activities and advocate for targeted funding opportunities. We support the LDAGs and also supporting the development of localised initiatives to drive to address local problems such as those community alcohol action plans. We also have tools as well to develop that. So you would have heard the team mention things like our mapping tool and that sort of thing. So from a Community Support and Development Programs team, we're the people that you can talk to that will be able to provide those sorts of tools to help in those planning processes. And we also provide opportunity for like-minded people to work in a mutually constructive manner. We are a commissioning service primarily. So we're one of the few teams that actually get to do a little bit of hands-on work. A lot of it's around commissioning and managing contracts and working with services in that capacity. But we do have alcohol and other drug prevention workers across the state. And with that, their roles are basically helping to build capacity of their community and within their agency. They also network. They have their agency prevention plans, which we work very closely with them on developing, that address local needs. And within that tends to sit the alcohol and other management groups, which are very similar to the alcohol action plans that we've seen spoken about today. And our AOD prevention workers in the regions obviously have a very keen knowledge of their region, what others are doing in the region, and what some of the current issues are. They also coordinate and localise the statewide campaign messages, much the same as what the Belmont, Vic Park and the Armadale, Canning, Gosnells groups have done with extending statewide campaign messages around alcohol. And there's a wide range of those messages from our campaigns team that can actually be used in those settings, and we do encourage those services to work closely with them. The other thing that the AOD prevention workers do in the regions and how we support them is around the implementation of liquor control measures. So we do our safe and healthy settings teams work with those agencies to actually look at things like liquor licensing applications, Section 175s, which might be dry communities in some of our remote locations, and Section 152s, which are alcohol-free residents, and also Section 64s, which are larger restriction-based applications. So that's where we sit supporting all those workers in the regions, and it does look a little bit different to what's happening in the metro area. So the Safer Settings team, their whole aim is around working in a systems-based approach to create supportive environments that promote optimal mental health and reduce alcohol and other drug-related harm. And this is where a lot of the work does happen with local governments, because we know that local governments' priorities are around creating safe and healthy settings for optimal health and well-being, and it fits really nicely then with their priorities now around developing their public health plans. So that's just a quick snapshot of what they actually will be do in that area. But what I wanted to move on to was exactly what they actually deliver. So the Safe and Supportive Settings team work with local governments, particularly on whole of organisation alcohol management, working with local planners on planner specific things. So that's looking around things like the different sections of planning codes when looking at liquor licence applications, policy and supporting resources for mentally healthy communities. So we have a range, and the next slide will show a range of tools for local governments that can also be implemented alongside alcohol management plans or individually and be considered within the public health plans. So how can MHC support local governments? We can work with you with co-design and working together. There is some data that is available. The provision of evidence-based information. So as I said, we look at the evidence base and are responsible for trying to, I guess, put that into practice out into our communities. Resources and campaign support material for local based programs and initiatives. Again, partnerships and collaboration within our team. Partnerships and collaboration is so important. So I certainly reiterate what Colby and Linda and Polish have been saying. Having those partnerships and collaboration and communicating with them is very, very important in gaining our outcomes. And also training. So there's training available, upskilling people, and we actually run training twice a year to actually teach people how to develop alcohol and other drug management plans. So in October, there's one coming up, so watch this space. And also we have toolkits too in terms of the campaign support materials. So there's a little picture there of our Think Mental Health community toolkit, and each campaign will have a toolkit that comes out with a whole heap of useful strategies and resources that local government, our alcohol and other drugs prevention officers in the regions can tap into, and community and LDAGs. So there's a whole range of information in those toolkits, and we do send them out periodically. We also have our prevention network that also supports that, those sorts of things as well. So the MHC website is a really good place to start, and there's a whole heap of links on there. In terms of what we do in the alcohol space, we do receive a lot of calls from local governments for assistance, particularly the Safer Settings team. Safer Settings team also provide advice to local government and related experts, and the WA Local Government Authority. We work in collaboration with existing networks and strategies to raise awareness regarding that practice and evidence base to reduce and prevent alcohol-related issues by creating those supporting low-risk environments. So there's a link here I've just popped up. So we do have our Managing Alcohol in Our Communities guide up on our MHC website for local governments to access. And we do know that local governments do identify alcohol as a priority as part of their public health planning, which is required under the Public Health Act. The role of MHC in the state public health plans, as I say, we do have the alcohol, but that has been recognised to be expanded not just to that, but also illicit drugs and misuse of drugs and other drugs of concern, optimising mental health and wellbeing, which again, our team works across the mental health and wellbeing space too. And to achieve the policy priorities, a number of priority activities have been identified and listed within them. So yeah, local governments have a big role in terms of their public health plan and linking in with groups such as the Belmont Vic Park and the Armadale County and Gosnells plans are probably a real bonus for local governments. We have 32 alcohol and other drug management plans across the state. Not all of them do have local government representation on them. There are a number that do, particularly the Wheat Belt, do that quite well. But I think as local governments start going into the process of doing their public health plans and looking at what they need to address, I think it's a really good tool for them to sort of be involved in those planning processes and look at their priorities as well and see where they can meet and actually work together. As I said, local governments do play an integral part in making a big difference to their community with regard to the health and wellbeing. And they can have some significant roles in reducing the alcohol-related harm in their community through their planning processes and through things like the example we saw with the alcohol advertising and limiting what type of advertisements can be put up on their local government-owned assets. That's a big win and that's fantastic effort. And we do acknowledge that trying to address all of the requirements of the public health plans can be difficult. And every local government's going to have different needs depending on their community. We know that local governments are feeling concerned in times of the cost financially, their time, effort and skills. So it makes sense to link into some of these existing plans because a lot of them are existing in their regions. Again, the other challenges that came up, and we've heard a couple of challenges the other week in facilitating a workshop for the Armadale County and Gosnells group, was that dealing and looking at legislation to control the number of licensed premises in the area can be complex for local governments themselves, right from their planning of issuing their section 30s and section 40s of their planning guides when an application comes through to navigating the state administrative tribunal when they're declining some of those applications, and also looking at the role of zoning as well. So there's lots of guides that we've got available that talk to that. So if anyone is interested and needs more information, I can put you in contact with the team. But local governments need to know that there is support and assistance there if needed, either through their prevention officers in their regions or through us at the Mental Health Commission in terms of this. Just wanted to touch on the wins, and some of them have already been acknowledged. the recent changes in local government policy related to alcohol advertising on their local government assets. That's a great win. Collaboration between local governments in the form of the action plans. Again, that's another really good win that we're seeing. And the other thing that we've seen, and I mentioned in one of our planning workshops the other week, is that in terms of managing alcohol in our communities, working with these organisations to look at objections to liquor licensing through the Safer Settings team, what we've seen over the years of doing that is more and more frequently now we're seeing applicants putting in their public interest assessments strategies to minimise harm as a result of their licenses. So they're preempting what we are going to be looking at and thinking about. So even that has had an impact on how licenses think about how they're supplying alcohol in their regions, but there's still more work to be done. So that's a quick summary. I hope that helped.
Thanks very much, Michelle. That was very helpful to hear all the wonderful things that you have available to help support local government. So thank you for sharing from the Mental Health Commission. I'd like to now hand over to Hayley Hawken, who's going to talk to us a little bit about the Local Drug Action Group. So Hayley, are you able to share your screen with us? All right. That's all right. Look, it is quite a feat this morning trying to juggle all the technology. We've got people presenting in the room, people presenting remotely. I feel a little bit like juggling. So thank you for your patience, folks. And here is Hayley.
Awesome. Thank you so much, Michelle. There we go. I'd just like to show my respect and acknowledge the traditional custodians of the land, elders past, present, and emerging on which this meeting takes place. My name is Hayley. I'm a Senior Community Development Officer at Local Drug Action Groups. I work with different communities across WA to support them with their alcohol and other drug prevention needs. A couple of quick fun facts about me. I have a pet snake, a beautiful greyhound. I love trying to outfish my partner, Ryan. And I also grew up in Walpole, which is right down south of WA, about a 5-hour drive. I am also just recovering from COVID, so apologies in advance if my voice runs out. Before I dive into about LDAG, I just want to touch on this model. It is still in development, and I think it summarizes really beautifully what we've sort of been discussing today about the relationship between LDAG, ADF, local governments, and the Mental Health Commission. When it is eventually approved, I'll see if I can send it through to the No Injury team and get it distributed to the participants. The reason I just want to touch on it though is because I understand a lot of people have been getting quite confused about the difference between LDAT and LDAG. And I think Linda or Colby, one of you touched briefly on this before, but so I am from LDAG, which is run by Local Drug Action Groups Incorporated, and LDAT, which Robert will be talking about next, is run by Alcohol and Drug Foundation. So Local Drug Action Groups were formed in 1996. There was a report done into alcohol abuse in 1995. And in that report, it was highlighted that some form of task force was needed. And that came in the form of Local Drug Action Groups. These groups are managed and supported by Local Drug Action Group Incorporated. We are located in Perth. We have around 6 staff members, and we are doing quite a lot of travel across WA. So what is an LDAG? It's a group made up of community members. Whilst previously this has predominantly been volunteers, we're definitely seeing a big shift to it becoming more stakeholder driven. These groups are made up of a chairperson, a secretary, treasurer, and other members. Every group is different. So as I said, yeah, there's quite often becoming a lot more stakeholder engagement, which is really great. And they have a focus on prevention of alcohol and other drug-related harms in the community. We currently have, I think it's 43 local drug action groups across WA, and our 3 metro groups that are linked in with the local governments too, which is great. So LDAGs have a really strong community focus. Linda touched on before about not being prescriptive. And I think that's one of the beautiful things about LDAG is we would never come in and sort of tell you what you need to do. I think it's up to your community. And we're here to really support you to establish what that is and what that looks like. I think community often knows best what's going on and what can be implemented to address those areas of concern. So our LDAGs all receive a range of support from LDAG Inc. I will cover external funding, financial and project support in the next couple of slides. But we do offer administration support, which I think can be really helpful, especially for new groups starting out who, you know, might just need some of those little admin things that no one likes doing. Training, we have a few different training modules that are offered. We also hold conferences every second year, which is a really great opportunity for the LDAGs to share what's been working for them. We have lots of merchandise that also promotes the sort of alcohol think again and other messages. Each of our groups receive up to $1,000 per financial year for operational funding. So this can cover things like catering for meetings, because who wants to go to a meeting without catering? Stationery, meeting hire, signage or other promotional material. We also have project funding, which I think has been referred to a few times. So each of our groups can apply for up to $9,000 per financial year, up to $3,000 under each of those 3 categories: community, parents, family, and youth. We also work closely with our groups to support them to apply for external funding. So that's a range of different people that we receive funding from. LDAG Inc. is able to auspice funding for the groups, which can be really helpful, especially, yeah, Linda's nodding her head, especially for the groups, you know, that are made up of a heap of stakeholders, because I'd hate to see it sort of, you know, just get a bit messy or something. So we do offer that support with, yeah, with the auspicing. That also includes financial management. So each of our groups are sent out a ledger every month, so they can see sort of, yeah, how much money's left in the external funding and their operational and any project funding they may have. Yeah, I think that's just a quick summary of LDAG. If anyone does have any questions, please feel free to pop them in the Q&A or send me an email. Wonderful, thank you.
Thanks very much, Hayley. I'll get you to put yourself on mute there and stop sharing your screen. Thank you. And we're going to hand over to Robert White from Alcohol and Drug Foundation, who's going to talk to us a little bit about the ADF and also about LDAP. So thank you, Robert.
Here we go. Sorry about that. G'day, so I'm Rob White, I'm Senior Community Development Officer at the Alcohol and Drug Foundation. I'm just going to talk very briefly about our organisation, some of the work we do and how we're able to support local governments. Firstly, I'd just like to acknowledge the traditional custodians of the land we're meeting on, the Whadjuk people. The origins of the ADF date back to the post-war years, and our organisation was established in response to returned servicemen using alcohol to cope with the trauma of war. The issues around drinking and drug use have never been more relevant. The modern day ADF has since grown into a national organisation that's funded by state and federal governments. Our work can be characterised as being independent, non-judgmental and evidence-based. As we're all well aware, alcohol and other drugs are extremely damaging with our communities, and the statistics here just show how enormous the toll on Australian society is. As an organisation, we believe a lot of the numbers in front of you are preventable, and the ADF's overall strategy involves both prevention and minimising alcohol and other drug harms to individuals, families, and the wider community. We have two core national programs at the ADF, the first of which is the Good Sports program that's been touched on a little bit earlier. Good Sports is Australia's largest and most successful grassroots community health promotion program of its kind. It reaches over 2 million Australians, and after 20 plus years of hard work and collaboration, we now have 10,000 clubs part of the Good Sports program and over 1,000 here in WA. With funding from Healthway, our staff work with community sporting clubs to build healthier club environments, and we provide them with an action plan focused around, but not limited to, reducing risky drinking, smoking and drink driving. And even though our WA team is based here in the metro area, we're focused on increasing our presence in regional areas, and we have been and will continue to get around the state in 2022. Finally, on Good Sports, clubs that participate in Good Sports see results. Independent evaluation has shown Good Sports reduce risky drinking at participating clubs by more than a third, and alcohol-related incidents dropped by a pretty substantial 42%. Local Drug Action Teams, or LDATs, is our second core project, and set up and run by locals with the help and guidance of the ADF and thanks to Australian government funding. The main aim of LDAT activities is to prevent the delay in use of alcohol and other drugs in local communities and to build partnerships and relationships with stakeholders to identify issues. As no two communities are the same, LDATs address these issues at a local level in a way of their choosing. An LDAT is typically comprised of groups such as local governments, health networks, police and community groups. And here in WA, we have 35 LDATs, and the program has provided over 2 million in grants nationally this financial year. There's a range of ways in which our organisation is able to assist the local government in executing its overarching AOD strategy. We can assist in identifying local issues, help with strategies and resources to support the formation or revision of a health and wellbeing plan, as well as support the implementation of an alcohol action plan or AOD management plan. We're able to also advocate for state-based messaging and evidence-based activities that align to priorities identified. And it's probably worth mentioning Good Sports here again as a strategy to prevent and reduce AOD harm. And in fact, we've had some really great collaborations over East with a lot of, or many local governments that are now requiring their clubs using their facilities to have an alcohol management plan. And as we're probably the gold standard in that regard, clubs then come to the Good Sports program to get accredited. Furthermore, we can provide tailored messaging around AOD, provide access to our ADF position statements and insights, help develop case studies, and provide access to a range of resources such as our life cycle planner, which assists in outlining the issues, risks and protective factors most appropriate for specific age demographics. Additionally, evidence-based toolkits and resources that are specifically dedicated to local governments. We're also able to provide tailored workshops via our LDAT and Good Sports programs, a great example being the numerous sporting club workshops we conduct in which we gather clubs from a local area and put on a sort of a learning event centred around a topic within the Good Sports program, which is directed towards club committees, leadership and volunteers. And we also include presentations from other relevant and local health services. Finally, we have a range of AOD information services available that a local government can tap into. Briefly, these include Australia's leading alcohol and drug research directory, the Drug Information Directory, which provides reliable information on AOD, mental health and links to treatment. And another example is Drug Info, which is a non-judgmental telephone and email information and referral service. So LJ, local governments that we've collaborated with in the past have benefited from hosting safer and healthier and more enjoyable events, fewer alcohol complaints, access to a range of resources, reductions in alcohol-related complaints, mention that, and public recognition for the work that they're doing in combating alcohol harm. So that wraps it up from me. It was very brief, but if you have any questions, you can direct them to myself or reach out to our Perth office, and I'm sure Injury Matters would be more than happy to connect us. Thank you very much.
Thanks so much, Rob. Really appreciate that overview of ADF. So if you could stop sharing your screen now, thank you. So I can hand over to Danitza Kerrick from the Cancer Council. So Danitza, I believe you have some slides you would like to share. So if you could share your screen, thank you. And then we'll hand over.
Can I just check that that looks okay to everyone?
You just need to put it on presentation mode. Yeah.
Is that, yep.
That's great.
Great, thank you. Oops, sorry, let me just fiddle with it for one sec.
Now we can see two screens. Oh, there we go. That's better. Thank you.
Okay, great. Thank you. Sorry about that. My name is Danitza Kerrick, and I'm an alcohol policy and research coordinator at Cancer Council WA. I'd also like to acknowledge the traditional custodians of the land on which I present today. For me, that's the Whadjuk people of the Noongar Nation, and I'd like to pay my respects to elders past and present. Our team works to inform community discussion about alcohol issues with the aim of reducing the impact of alcohol on the WA community, including as a cause of cancer. We are the NGO partner of the Mental Health Commission's suite of public education campaigns that's been talked about a lot today, including the Alcohol Think Again program. So together with the MHC, we're responsible for helping to build community awareness of alcohol-related harms and ways to reduce the risk of those harms. We also have responsibility for helping to increase public awareness of and support for evidence-based alcohol policy. So some of this work is funded by the Mental Health Commission, and we also receive funding from Healthway to build the case for governments to introduce evidence-based policy measures to reduce harm from alcohol. Our work is informed by the World Health Organization's best buys that Colby mentioned before, and other recommended interventions that are known to prevent alcohol-related harm. So these include increasing alcohol taxes and a minimum price on alcohol, restricting the availability of alcohol, and bans or comprehensive restrictions on alcohol advertising. Cancer Council works closely with several local governments on a range of public health initiatives. We do this by providing support and helping to add value to work that's already happening within local governments. We're guided by the needs of each local government in the support that we provide. So our work with local governments really depends on where each local government is at. We're happy to work with local governments to help identify where and how action on key alcohol issues aligns with existing plans and strategies that are already in place. So we've heard a little bit about the kinds of support that we've been able to provide, but by way of example, to date, we've supported local governments to develop their public health plans. We've helped to build local evidence to support the case for action on alcohol. So for example, we heard this morning about the bus stop audits that capture the volume of alcohol marketing in a local government area. We've also helped to draft policies, tenders, and contracts to help local governments remove alcohol marketing from their outdoor advertising assets. We've helped with preparing summaries of the evidence base, and we've helped to develop and implement alcohol action plans through local drug action groups and local drug action teams. So for us, working on alcohol action plans with local governments, health service providers, and other NGOs has a number of mutual benefits, including opportunities to come together to share knowledge, experience, capacity, and strategies to reduce harm from alcohol. We feel that there's really genuine collaboration and that we all can learn from each other. So for that reason, we really do welcome and are more than happy to work with other local governments to reduce harm from alcohol in our communities. So that was very quick and brief, and I'm mindful that we're over time as well. But if you do have any queries, you're welcome to contact us at alcoholprograms@caswa.asn.au. Thank you.
Thanks very much, Danitza. Yes, we are a little bit over time, but there are a couple of questions that we'd like to see if we can get an answer for. First one is for Colby and Linda. Just wondering how you did the evaluation for the Youth Amazing Race event and how you reached people doing these activities. Oh, maybe put your mic on, sorry.
Sorry, unmuted now. It was mostly process evaluation. So we had the question sheets that were all handed in at the end. So we could see from those if the attendees were answering appropriately, and each stall holder had the clues to the answers as well. So for us, the evaluation wasn't so much awareness, because the purpose of the event was about connection. So we used the maps and participation sheets to see that the participants had gone to each of the stakeholders and had some really quality interaction with them. And that was based on feedback from the service providers as well. And how do you reach people doing these activities? I suppose each service provider came along with a really fun and engaging interactive activity as well. So that meant naturally that the young people engage with the service providers as well. Do you want to add anything, Linda?
I think to promote the activity, and bearing in mind it was during the peak COVID period, but we felt like there was a really good attendance, better than we expected. Local governments supported the promotion of the activity. It was during Youth Week, so we really deliberately aligned that activity with Youth Week for local government, and they promoted it on their websites, Facebook pages, and the local governments that had youth groups as well.
Great, thank you.
Hopefully that answered your question.
Thank you. There's one more question, and this is, I'm not sure who we can direct this to, but maybe somebody has the answer. The person here is looking for a toolkit, wondering if there's a toolkit available for schools to use to raise awareness to parents, guardians, students that are 18 around secondary supply laws, especially around key times such as school balls, leavers, and end of season sports gatherings. So who wants to take that?
I can do that.
Yeah.
Linda. It's Michelle here. Look, we always run a campaign around that time which is currently the Alcon Young People campaign. I need you to say no, but I do believe we've got a new campaign that will be coming out shortly before Leavers. As with all of those sorts of things, there will be toolkits attached to it. So my best suggestion would be, I'll pass on the details for the prevention network, but if you're not part of the health promotion teams or prevention coordinators, hop onto the prevention network and there'll be access to those toolkits to be able to be used. Not sure what will be in them at the moment, but seeing as there's a specific request there, I will feed that onto the campaigns team and see if they can include some information for you.
All right, thank you. Did anyone else have anything to add to that? No?
Department of Education, and he is engaged with schools. And when we did our school program, some of the toolkits actually came in. He might be a very good source to gather those information or have a conversation with him, and he will be providing you at least with a very good guideline. So why to get those toolkits, and he will certainly have some toolkits which will certainly help.
All right, thank you, Polash, for that. So we've got some help available. So if anybody's interested in any of those things and not sure who to contact, please feel free to contact Injury Matters and we can certainly put you in touch with the right people. All right, we're very close now, folks. We'd like to thank all of our speakers this morning. We thank the East Metro team, Magdalene, Ellie, Michelle Gray from Mental Health Commission, Hayley from Local Drug Action Group, Robert from Alcohol and Other Drugs, and Denitza from Cancer Council. I'd also like to just point you in the direction of a couple of resources that Injury Matters has to help support. So we also do some work with local governments, so you can access injury data through us, and we also have an alcohol resource that you can certainly look at through our website and download. We have a number of upcoming trainings and events available too in the injury prevention space. So if you're interested in doing more webinars or trainings, please check out our events calendar. If you're interested in continuing conversations like we've been having today, you can join the Injury Prevention Network. This is a really important conversation to have to reduce all sorts of injuries around WA. So if that's something that interests you, please contact Apu so she can put you on our network. There's also a professional networking opportunity through our Connected program. So if you're interested in talking to other people working in various types of injury and you'd like to meet as a professional networking opportunity, you can join our Connected program. At the end of the webinar today, you will notice there's a pop-up asking you to fill in a survey. It's a very short survey. We'd love your feedback. If you could just take a couple of minutes to do that for us, we'd very much appreciate it. So I'd like to thank you for your time today. Thank all our speakers for coming and hope that's been very informative. And all of the participants of today's webinar will receive a link to the recording for this webinar. So thank you very much for your time. And we look forward to seeing you at another one of our webinars in the not too distant future. Thanks, everybody.